FrankMurray, welcome back to the show. Now, have you ever heard of the condition haemochromatosis? If not, it's a genetic disorder that is found in people of Celtic origin, which causes them to absorb too much iron in their blood. Now, 1 in 83 people in Ireland have this. And here to tell us a bit more about it is Dr. FrankMurray. The Celtic curse, is that really what it's called?
Well, it's called that because the prevalence, or how common it is higher in Ireland than anywhere else in the world.
Oh my God, aren't we so lucky?
Yeah, so and people are particularly interested in haemochromatosis in Ireland on an international basis because it's so common here.
Really, and I suppose we've got more cases to study, etc. and so
yes.
forth. But how would one know if one had haemochromatosis?
Well, very often people don't know they've got haemochromatosis because it doesn't cause symptoms until it's very far advanced. And now most people are diagnosed well in advance of having symptoms because it's often picked up through blood tests, either done routinely through general practice in general or in hospitals, or because they've got a family history of it.
Yeah. So haemochromatosis, basically, what is it?
So it's an accumulation of excess iron within the body in the important and vital organs, particularly in the liver, in the pancreas, and in the skin, and in other endocrine organs as well.
Yeah.
And as a consequence of that, it can lead to cirrhosis and to liver failure, to diabetes, and to other conditions as well.
So if you're not diagnosed, and if you haven't been fortunate enough to know that this either runs in your family or that you have it, you could have irreparable damage done by the time it's picked up.
Yes.
Sorry, I'm going to scare everybody now.
It's worth saying that the situation is much better now than it was 20 or 30 years ago because we've got much more sophisticated and accurate ways of diagnosing the condition. And also, most doctors are far more aware of it than previously. So most of the patients we get referred to us in hospitals who've got haemochromatosis have very mild disease, and most of them don't have any damage to any of their internal organs, which is brilliant altogether, providing they enter treatment appropriately and stay within treatment.
And what is the treatment for it?
So it's one of the great conditions to have in the sense that it doesn't involve the administration of any drugs. So because it's a condition of too much iron in the body, the way we de-iron a person who's got haemochromatosis is by commencing what we call phlebotomy or venesection. So the patient,
okay, that sounds a bit scary now.
Yeah, it's actually not that scary. It's exactly the same process that people undergo when they go to give a unit of blood in the blood bank or blood transfusion service. Yeah. So we take off a unit of blood in a very simple way, and every week or two, or sometimes twice a week, depending on the severity of the disease, until the patient is de-ironed. And that will take usually several months or maybe a year, just depending on the level of iron.
Wow, that sounds... Yeah. So once you are de-ironed, you have to keep going back every month or every week, or how prevalent can it be?
So most, I'd say the average time to losing the excess iron is maybe 4 to 6 months. Yeah. And once that happens, the patients just come about 2 to 4 times per year. And we just keep their levels nice and low and safe. Yeah. So it's worth saying it's more severe, as you've already referred to, in men. It can also be much more severe if people use alcohol, because if you use alcohol, the effects of harmful factors on the liver are cumulative. So if you've got a harmful effect from iron overload and from alcohol, or from being overweight and having too much fat in your liver, they're cumulative effects, and they cumulatively damage the liver.
Yeah. So basically, if you look at women, we have natural ways of getting rid of iron in our bodies. And we were speaking about it in the break before we were on air. You either have your menstrual cycle that will get rid of excess iron. You were saying women give birth to children, so that takes off, and breastfeeding, etc. and so forth. So in females, it's not as, I suppose, dangerous undiagnosed until a certain age as it would be in men, for the reasons you just said. So when you're talking about, I suppose, is the liver the main organ that it would affect?
So the liver, the pancreas, other glands in the body, such as, say, the pituitary gland, which is just underneath the brain, or the thyroid. It can also lead to skin pigmentation. The traditional name for the disease was called bronze diabetes. So it was diabetes with cirrhosis with pigmentation, but we don't see that now, really. I mean, we see a
it's
much
caught before then.
Yes, in general. Now we still can see patients who die from it, but it's much less common than previously. Because of increased awareness among the medical profession, increased awareness among patients, and because we are able to diagnose it much more accurately, because the testing is much better. And I might comment on the testing, because the testing...
So I was wondering, does a normal blood test, if you're doing, let's say, your checkup, and let's say, a lot of people do them maybe once a year now for a health insurance purpose or whatever, will a normal blood test pick it up, like a normal screening, or do you have to specifically look for it?
So you have to specifically look for iron storage protein, or iron levels within the blood. And that would be common commonly done for a whole variety of reasons in general practice or in hospital care. If once that's picked up, we would then go on generally to do a genetic test for hemochromatosis, which is a slightly more sophisticated test, which is quite widely available now. And that will allow us to identify whether or not the person has genetic hemochromatosis, which is the type we see most commonly here in Ireland. It is worth saying, I think, that most people who've got an elevated serum ferritin or serum iron storage protein level actually would turn out not to have hemochromatosis. They'll have that protein at an increased level in their blood because of perhaps having fat in their liver, or using alcohol, or using having an acute illness, because it's what we call an acute phase reactant. In other words, you get a bump when people are acutely ill.
Yeah, and when it comes to damage to your liver, I know the liver is one of the most resilient organs we have, but once it's gone into a damaged phase, I know they're all a bit scared about the alcohol and the fat around your liver and bad food. Once it is...
Sorry, we've all given up alcohol.
I know.
We had a chat with the professor before we came on air.
This afternoon.
Yeah, we've all now given up.
Yeah. So, but is there, if you do find that you have a damaged liver, a damaged organ, is there some way back from it, or is some of the damage irreparable?
So there is a myth that the liver is great at regenerating.
Oh, God, is that not true?
In its breath. And so if you get an acute insult to your liver, for instance, paracetamol poisoning, and if somebody gets a really bad process that damages the liver there and then and over a few days, and that's removed and they survive, then your liver will go back to normal. However, if people have a chronic illness like viral hepatitis, hemochromatosis, alcohol, fat in the liver, they're the biggest four we see in Ireland. If patients have a problem with that, once it gets to a certain critical point, the process is irreversible. And they have cirrhosis, and they are very likely to develop liver failure and either die or need a transplant from it. So unfortunately, you don't get a little bit of symptoms that indicate that there is a problem that is going to be reversible. Very often, unfortunately. And we see that in the hospitals all the time, because when we see people who come in and present with, say, advanced liver disease due to alcohol or due to hemochromatosis, once they have cirrhosis, it's not reversible.
Yeah. Now, is there any mild symptoms at all, or is there any kind of warning signs for anybody watching this today that can say, I don't know whether or not it's in my family, if it's not in my family, whether I have it or not? What do doctors look out for?
So what they look out... So what I would say is that now most people present with hemochromatosis don't have any symptoms specifically ascribed to it, or very few. So fatigue is typically said to be a prominent feature, but actually fatigue is almost universal. Nearly everybody.
We're all exhausted these days.
Many people feel that they're exhausted, and so it's not a good discriminating symptom. We see a lot of people who present to the GP and their liver tests, their liver chemistry, liver blood tests are abnormal. Liver function test, yes. And a routine part of the testing we would do for that sort of situation is to check, have they got an elevated level of iron or ferritin in their blood? So it's the second thing. A third thing is that some people present with arthritis symptoms, particularly on these joints here in their hand. And so many doctors, including rheumatologists, if they go to the more general practitioners, would think, that's an unusual pattern of arthritis just there, and check for hemochromatosis. Also, if people present with sexual dysfunction, for instance, impotence.
Erectile dysfunction in men,
So it's certainly worth checking patients like that for levels of ferritin, and do they have hemochromatosis. So there are many symptoms that are quite broad, as you can see, that can be presenting symptoms of hemochromatosis. The great thing is, if you get diagnosed with hemochromatosis, and you are referred to an appropriate service and you go on treatment with getting your blood taken off and it goes back to normal, you will not die from hemochromatosis. You'll die from something else.
It's very treatable.
It's very treatable.
It's a chronic condition rather than something that will kill you if you get it caught in time.
Yeah, and if you think of it, providing you haven't gotten over that tipping point, which I mentioned earlier on, you don't have cirrhosis, you don't have diabetes, your situation is very good, and you won't have any problems from it. But it's the detection that's the key thing. So I think an awareness of it is a really good thing. To be aware of hemochromatosis, both as patients and as doctors. And if you've got it in your family, I think it's very worthwhile being checked for hemochromatosis. And
so for any information on that, I think we have a website there. Yes, indeed. So it's hemochromatosis/ir.com. So if you do have any questions, and it's a relatively simple blood test, your blood is taken and sent away, and you'll have an answer either way. And then I suppose if the iron is off, then you can get the genetic testing done.
Yes, exactly.
Thank you so much for joining us on the show today. It has been an education, even though you're after scaring the bejesus out of my panel. But anyway, thank you very much. Now we'll take a quick break. So